Hi, my name is Nadeem Khan. I'm the Clinic Director at the Harley Street Hair Clinic, and we're here today to show you some steps that we're taking to protect patients during the COVID-19 pandemic. Infection control has always been incredibly important, but in these times with COVID-19, it's important for patients to understand why certain steps are taken to protect them and also to provide the best quality transplantation. It's confusing for patients because most of them are looking, for us to provide them with the wow result, but issues like infection control are more important now than ever. We've been quite lucky in that this clinic has been purpose-built for hair transplantation, which gives us significant advantages over other clinics. The work surfaces, especially in clinical areas, have been designed for this type of application. We use a surface called Hymax, which is quite unique because it's actually 75% stone, natural stone, wrapped up in an acrylic matrix. The reason why we use that is because the surface is non-porous, and as a result of it is completely hygienic because it's easy to clean, but also bacteria and compounds can't stick on the actual surface. We use marking to show that this area, for example, has been cleaned today a few hours ago. This is helpful in maintaining visible infection control and also enabling good habits for all staff and for all patients to be reassured this area has been prepared and ready for usage. Technology like these stereo microscopes enable nurses to not require to touch the microscope and sit here in an ergonomic fashion without touching the actual lens. The non-touch technology also translates to simple areas like the bathrooms, including hand drying, which is done with a choice of towels if people wish to, but also to have hand dryers that involve no touch technology. All instruments are sent off-site to be prepared and processed before they're sent back to the clinic before they can be used on patients. We use ethylene oxide preparation, which is the best form of decontamination for surgical instruments. For flooring, this one is called Polyfloor. As you can see, it's fitted with an uprising to help with infection control, and also it's easier to clean. We have a range of different PPE available for patients to use while they're here, but as a minimum we would require them to have a surgical mask and be tested for temperature and also washing hands, which is very important. All the testing and protocols that we have for patients, the staff have to do the same thing, the same daily checks. We've introduced zones to keep people apart to help with social distancing. You can see here we have markers on the floor to ensure 2 meters separation, and we've got screens that we've installed where there is significant patient and staff contact. Patients need to, as ever, do their research, but also find out the clinics that are reputable and also able to give them more information on management of infection control, as well as the other environmental variables around the clinic, for example, instrument processing, and some of the steps that clinics take to protect patients. I think it's fair for people to ask that.